We've got a very busy person who's taken time out of their morning to join us this morning, Dr. Teresa Frankovich from the Public Health Department. How are you on a Friday morning?
I'm doing well this morning. How about you?
Well, not bad. Yeah, a lot of people, of course, you're carrying a lot of weight on your shoulders. And I got to thinking the other day, okay, you're a human being just like the rest of us. What's the pressure like on you these days? Was it anything you ever anticipated when you said, yes, I'll take that job?
Well, I've been doing public health in Michigan in a rural area for about 10 years before I came here, but, and went through Ebola and H1N1, but I would tell you in a heartbeat, this is different from anything I've done in my career. And, the same is when you talk to public health folks across the state and even across the country. This is just a really new situation for everybody.
As new as it is for everybody, is there any kind of uniqueness for Humboldt County versus where you came from, or as we assume there must be some kind of differences between us and the Bay Area or the Los Angeles area?
Sure. Well, I think, the one clear difference is, the rural nature for us in the state and distance from the large urban areas. And so that makes the experience different for us. And that local nuance is really important, I think. I think a lot of rural areas across the country are in that similar position. But what really strikes me about Humboldt is, and I loved where I came from in Michigan as well, but, the health department here and the infrastructure for responding to emergencies, I think is really robust here. And I think part of that is because of the history, with earthquakes and fires and things like that. So the ability to sort of set up an emergency response and to have it really a vigorous one is a huge advantage in our area, and I appreciate it every day, honestly. The EOC, the sheriff, and the ability for public health to coordinate with all these partners who are used to working together is really nice.
So at this point, I know we've got emergency services set up in case the extreme happens, like at Redwood Acres and so forth. Do you feel pretty confident if we do have this extreme that we hope doesn't happen? But if it does, are we ready?
Well, I think we're really getting close. You're right. The alternate care site that we're working on is an important piece of that. The hospitals really have been working for quite some time here on how to expand capacity within their walls and really, increase beds, increase ICU bed capacity, increase ventilator ability. We've been working on how to have enough workforce because you can have all the beds in the world, but if you don't have people to staff them, you can't provide the right care. And so, that has been a work in progress for quite some time. The alternate care site we've been planning on for a long time, but got the infrastructure pieces from the state just recently, and have been building that piece, as well as working with hospital partners on sort of what are all the pieces of operating that. Our vision for that is, not to be able to provide high-level, hospital ICU kind of care in that setting. The idea really of these is to be able to take the pressure off hospitals so that if they need to provide that higher level care, people who just need a bit of care, aren't ready to be in the home, maybe need a little bit of oxygen and monitoring, those folks can come out of a hospital setting, have a safe place to be until they are able to return home. And, like everyone, I'm hoping we actually never need it. That would be great. And as the fire guys tell me in the EOC, it's, plan for the worst and hope for the best. And that's really where we are. But, it's all an uncertainty a bit going forward, so I think the safest thing for our county is to have it there.
All right. Well, let me ask you this. It's my understanding, and I've seen this from medical updates out of the Bay Area, that some of the hospitals and facilities down there are prepared just like we are, extra staff and so forth, but we haven't had the impact. And now they're starting to feel a financial pinch and letting some people go. We see the Navy ship left either yesterday morning or this morning out of New York. At what point do we go, okay, and I even understand that some local labs, local hospitals are starting now to schedule some appointments and some care. At what point do we kind of relax our medical people to let them get back to what else is needed besides the COVID-19 attention?
Sure, that's a really good question. Yeah, we've been working with hospital partners as well as outpatient. And you're right. We're because we've been so effective at this shelter in place, more effective than sort of we dreamed that we could be, frankly. It's provided this window of opportunity, I think, where things have calmed down. We can open up and let some of that health care that really needs to happen occur. So, we don't want people to have to defer for, many months getting some of those preventative health screenings that they need. We definitely want people immunized. We want people to be able to have some surgeries that are really important. And so I think this is the window for people to do that. I think because we don't have large numbers of COVID patients, for instance, in a hospital setting right now, it's a place that people can go and get care and feel confident about that, and that the hospitals know how to protect them and keep them safe. I think it's a good idea for people to make that move right now, because I think we don't know what the terrain will look like a few months from now. And I think as we open things up, we're gonna just be taking the temperature constantly.
Let me ask you this. Talking about opening things up, we got golf courses, I guess, have been allowed to be opened here locally here as of today. I've always been confused, and so educate me if you would. Costco, Target, Winco, some of these large places, the essentials, we've been able to go, and thank goodness, and get what we need. What's the difference if the safety precautions are enacted of one of those where we have 50 or 60 people in a large building versus one or two in a small business that might want to sell me houseplants or a pair of shoes or something?
Right. Well, I think that the point kind of you're getting to with this is that, everybody needs to have the safety precautions. Out of the gate on this, the distinction was those essential businesses, critical infrastructure that we were going to maintain throughout. And that's where, some of those stores like Target were able to be open because they provided food. And entities that provided food in general were considered part of essential services. So our restaurants that could do delivery or, takeout, our grocery stores, our pharmacies, all of those businesses. So it wasn't really related to size, but it was just related to what they did. I think going forward, I think our emphasis needs to be on the low-risk versus higher-risk enterprises, and not so much on what the value of a business is to the community, or even the designation of essential versus non-essential as we go forward. It was an important distinction at the beginning, but I think as we open things up, the emphasis is really going to be what can we operate safely, and then how can we open things up, mainly the idea of going some at a time, not everything all at once, is because, again, as we open, we're going to start to mix people. And at first we'll mix them a bit, and then we're going to mix them more. And we expect to see increased transmission when we do that. And in order not to get ourselves into trouble in terms of too much transmission too fast, we can't open the floodgates all at once because we might invite kind of bad consequences. So we're going to open it, see what happens, and then if we're doing well, open more and just keep that process going forward. So all our businesses, I agree with you. A small retailer, for instance, that sells clothing, small retailers that do all kinds of things, our galleries, our other kinds of shops, I think those are places that they can make safe work plans, and I think those are places that we really want to target as being able to open if they've got a safe work plan in place as soon as we're able.
So let me ask you the question that's on everybody's mind. What markers are on the wall that you're looking for